Hey everybody, this is Dr. Roy Vangtama, and this is my COVID-19 number 7 update. Thank you to Jeremy Luke for getting me to record this instead of just write it. He's like, yo, people don't like to read. So here you go, Jeremy, this is for you. Okay, so item number 1 is thank you so much to everybody for all your well wishes. As a doctor and all the healthcare practitioners, we really appreciate your support. You know, it's really the first time where I, as a doctor, have actually had my life actually threatened in any way by anything that I've treated before. And I know for people who do Doctors Without Borders, that might be more common experience, but for the most part, most doctors I know are experiencing this for the first time. We sign an oath to do no harm, but the question is, does that do no harm extend to ourselves? And I think that's just a personal decision. For me, I definitely have to do it. You know, I know that if I'm not doing it, someone else has to come in and take my place, and that's not acceptable to me. It is stressful, and that leads to item number 2. Have you noticed a drop in your libido during COVID-19 pandemic? Well, that's very normal because 85% of people who experience stress in a prolonged way have a drop in their libido. And why is that? Because in your body, you have a physical manifestation of this type of stress from separation and prolonged isolation. And it results in an increase in cortisol and paradoxically increase in oxytocin, actually. And this prolonged stress response will actually put you in that fight or flight mode and drop your libido. So you have every right to say, I'm sorry, honey, it's not you, it's COVID-19. And if you're in that other 15% that gets excited by extreme circumstances, then you're probably more like Dexter or Fleabag, one end or the other. Okay, number 3. The thing you might find also in this pandemic is that you're more triggered lately about things that have happened to you in the past. Things might be coming up, traumatic or events of abuse, whether it's physical, mental, emotional, or spiritual. You know, any kind of trauma you've had in the past can be coming up back now, triggered by this traumatic event. It's almost like a re-triggering. And if that's happening, really become aware of it. Talk to a therapist, journal, talk to a trusted friend. And that comes to item number 4. The most unwise choice you can do with these feelings coming up is to suppress it. Suppression of anger or resentment leads to a drop in the immune system. And a drop in the immune system, you guessed it, can lead to more infections, and if it's done for too long, can lead to cancer. Yes, that is true. Ask me for the sources if you don't believe me, all my medical friends out there. It can lead to cancer. Okay, that leads to item number 5. One simple and effective way for you to actually deal with this is to do a little exercise that was taught to me by Kate McGregor Stewart, my coach and friend. It's called a body inventory. What you do is you simply put yourself in a room like this where it's very private and you ask yourself, how do I feel? And then you answer. I feel tense in my hips. I feel some tightness in my chest. And then you ask it again, how do I feel? And you answer, my hands are cold. I feel a little nervous in here. And you keep asking and answering till you reach a place of calmness. Try it. It's really simple and it's totally free. Okay, now if you're having those really explosive sort of emotions and there's no safe place for you to actually express those things, I recommend something else, and it's something taught to me by Angel Harper, who's a counselor, spiritual counselor, and a friend of mine. It's called burn pages. So what you do is, again, you lock yourself in a room, turn your phone off, set a timer, get some scrap paper and a pencil and pen, and you write. You cannot stop for the amount of time you're giving yourself, no matter what. You write. You can write anything. You can say, Dr. Roy's stupid, this is stupid, this is a waste of my time, I'd rather be watching CNN, whatever you want to write, but you can't stop. And then when you're done, guess what you do with those pages? You burn them in a fireplace, or you rip them up, or you shred them, but you dispose of them in a way where no one can read them, not even yourself. It's not a journal, they're burned pages. The reason why you want to do that is because if subconsciously you know that you're going to be able to read them, you will censor yourself, you will suppress that yourself. You're doing this to clear yourself and give yourself an opportunity to self-regulate. Last point. So what if all this stuff doesn't mean anything to you? You don't want to do it. That's totally fine. Do something that's expressive emotionally, like dancing or writing a song or learning a new language, anything like that, just to give yourself an expressive way to deal with this. If you're into self-improvement, please check out my free quiz and email course at mdroy.com. 16-question evidence-based quiz that'll help you find that one thing that you want to change in your life. You can totally do the quiz and you'll get a 5-lesson course that is totally personalized to you. And you can also interact with me and ask questions about the results of your quiz and the course. So I hope this is really helpful. This is the emotional COVID-19 number 7 update. Thanks.